What's going on, guys? Dr. Corey Choffner here, coming at you, doctor of physical therapy as well as strength and conditioning coach, working with people online and in person. I'm helping them improve their overhead squat mobility, helping them improve their overall kind of lower body squat mobility, and helping them decrease pain and increasing strength in the process as well. So thank you guys so much for joining us. We have a super important topic tonight, and I want to make an important announcement that February here of 2023 is going to focus on the knee joint solely, and more specifically the meniscus, because we deal with so many meniscus issues time and time again. So we're going to dive into that in kind of further detail for this month. All right, and tonight's topic is going to be solving the mystery of knee pain. Is it truly the meniscus? And I'm going to go through some tests, 5 to be specific, that you're going to want to look out for, and you're going to want to do or have a friend perform on you so you know if it is the meniscus or if it's like another issue causing damage. Okay, so 3 things we're going to cover in detail. Number 1 is what is the meniscus? Number 2 is why is the meniscus important for your knee health overall? And number 3 is how to figure out if the meniscus is injured and if it's causing your knee pain, right? Because sometimes it could be other ligaments going on with damage. Sometimes it could be kind of muscles around that joint. Sometimes it could be damage to the bone, like a fracture, and it could be an underlying hairline fracture. Depends on the mechanism of injury. We're not going to go down that kind of rabbit hole because we can get stuck there all night. But let's get into kind of the what. So what is the meniscus in detail? All right, meniscus is really just simply put, guys, cartilage, right? It's like a protective pillow, and it sits between the femur and the tibia bone, which is kind of, it makes up the knee joint, right? And it makes up the kind of entirety of that knee joint. It just sits kind of between those 2 bones. So these are the 2 bones. It kind of sits like a pillow, and it's 2 little C-shaped curves. One's on the inner part of the knee, one's on the outer part of the knee. And guys, to be honest with you, we're not going to dive into it too much, but the outer layer receives blood supply while the innermost layer does not. So if you have damage to the innermost layer, most of the times it's not going to heal or recover, and that's when you need surgery. We have to look at alternative routes of treatment. Okay, but we are going to do a video on this, so stay tuned for the next couple of weeks because we're going to dive deeper into that, about talking about the avascular and the vascular layer. So number 2 is why? Why is the meniscus important for knee health? The meniscus is important for knee health because it's, like I said, a pillow. It helps absorb shock, force when we land, when we jump, even when we walk, right? A lot of people are heavy walkers, meaning like you can hear them coming, right? They pound their heel on the ground. They make all this noise. When they land, say they're doing box jumps in the gym, you always know, like, hey, it's Patty over there. She's landing abruptly on her heel. And a lot of times that can lead to kind of degradation or wear down of that meniscus over time. So that meniscus is so important because it allows our joints, right, the knee joint specifically, which is formed by the femur and the tibia bone, to kind of glide smoothly against each other so they don't rub. Right, and that's why a lot of people need kind of a knee replacement, because their meniscus gets worn down to a point where they have so much arthritis and inflammation in their knee that joint just isn't functioning properly. It's like kind of nails on a chalkboard, right? It causes more inflammation every time they bend their knee. They kind of go into a squat, a lunge, they go up and down stairs, and where they initially have to have kind of that bone shaved down quite a bit, and then actually replace the joint, which is like replacing the meniscus in a sense too. Okay, so number 3 here is how to figure out if your meniscus is injured, or how to figure out if it's really causing your knee pain, right? There's 3 things I want you to do first before we get into those 5 tests I mentioned at the beginning of the call. The 3 things first are, number 1 is look at your hip mobility. You want to look at passive or active assisted. And all that means is passive is like if I was working on you, you're in the PT clinic, I would be holding your leg and taking it through motions. And the 2 motions you want to look at, in average, in normality, I can't really talk, excuse me, is internal rotation and external rotation. All that means is you're kind of rotating the lower leg inwards for external rotation and outwards for internal rotation. That's so important to look at. You can do it active assisted too. You can just bring your knee up to about 90 degrees, so it's above your kind of hip joint when you're laying on your back, and you can bring that leg inwards and you can bring it outwards. That's another way to kind of look at that passive hip mobility. That's an important thing to address. If you don't have a lot of hip motion above that knee joint, you're gonna have damage, you're gonna have some discomfort during squats and things like that. Number 2 is ankle mobility. You wanna use the 5-inch wall dorsiflexion test. If you don't know what it is, look it up. We've talked about it a lot, especially past month, this past month of January, where we focused on the ankle joint in specific, and we looked at Achilles tendonitis. You get a tape measure, you're about 5 inches from the wall in a kneeling lunge position, right? And you try and move your knee right over your toes and try and touch your knee to the wall without your heels popping up. If you don't touch, you got to measure how far you are from the wall, and that means that you have tight ankles, right? So you want to work on your ankle joint mobility or your calf length by doing some calf stretches. If you have questions on that, put them down below or go back to our previous videos on our YouTube. Number 3 is load tolerance, right? So we talked about hip mobility, ankle mobility. Number 3 is load tolerance. So I always like to start people with a single leg squat if they can tolerate that. I want to see how they do side to side. Sometimes the knee wobbles a lot on that frontal plane, and that means that their glute muscle can be really weak, and you got to work on their hip mobility, or it could mean that their foot is unstable. You got to watch the foot too. If they do that really well, I'll move them to a double leg tuck jump, where you just jump up and drive your knees to your chest, and I kind of focus on how they land with that. If they do that really well, I'll move to a single leg tuck jump. And then if they do that well, we'll finally finish with a single leg bridge test. And that's going to show me how well their glute is functioning, how kind of supportive their foot is and how strong it is, but also how their knees tolerating these things, right? If you have a meniscus issue, most likely can't do any of those 4 things I just mentioned. All right, so to recap, look at hip mobility, ankle mobility, and see how your knee tolerates load first. Okay, those are the 3 most important things to address first, and then you're going to get into special tests, right? So there's something called the clinical prediction rule, and it's 5 tests you want to do in this exact order, which I'm going to go through now. They're really simple to do. I'm going to share my screen with you in a second and show you a small video of that too. But you want to do these tests. If you have 3 of these positive out of the 5, you most likely are dealing with a meniscus issue. It could be a tear, a full tear, it could be a partial tear. It just depends. And if you guys have more questions or you want to see a study where I got this from, feel free to ask below in the comments, and I'll be happy to share it with you guys. So these 5 tests, starting with number 1, are history of catching or locking reported by the patient, right? So if you're going up and down stairs or you're doing squats and you feel your knee catching all the time, and you feel like you got to shake it out or like got to shimmy it a little bit and rotate for it to unlock, that could be positive for this test, okay? That's number 1. Number 2 is joint line tenderness. So if you take your fingers and you go kind of to the probably 2 or 3 centimeters kind of below kind of the middle of the knee joint. So find the middle of the kneecap, go a little bit below that, and you palpate with your fingers. You can press like maybe an inch or 2 inwards along the outside and the inside of the knee along the joint line. If you're tender there or you feel a little bit of pain when you press, and you shouldn't, right, then you're probably positive on that test. So that's number 2. And number 3 here is pain with forced hyperextension. It's called the modified bounce home test. All that means is that it's like if I was holding your leg and I was supporting your knee, my hand was underneath your knee and I just let it drop, right? If your knee bounced back up and it didn't just stay in that straight position, that would most likely mean, it's a positive test. So you can kind of do it yourself, like where your foot's up on like a stool and then you bend your knee and let your knee drop. If it doesn't bounce, right, it's a negative test. All right, number 4 is pain with maximal passive knee flexion. That's a mouthful. So in short terms, right, or simple terms, it just means like, someone, it could be a friend, could be me, could be a physical therapist, you're laying on your back and they're bending your knee as much as they can. So they're bringing your heel as close as they can to your butt as you're laying on your back. And if you have pain with that at end range, no pain at all during the range, just at end as I push you into your maximal end range, then that's a positive test, okay? And then number 5, the last one, is pain or audible click with a McMurray's maneuver. Okay, and that's a video I'm going to show you right now before we kind of wrap up. McMurray's maneuver is really simple. All you're doing is you're having, a therapist or a friend do this. You're laying on your back, the knees bent, and you have them turn your kind of tibia, or they turn your foot connected to kind of that tibia bone inwards, and then they kind of bring you into full straightening of your leg, and then they come back up into a knee bent position, and then they turn it all the way outwards, and then they kind of bring you to a straight position. So those tests are super important because they're going to tell you what's going on in terms of the meniscus. They're going to show you, if you're doing it one way where you're turning in and then you're coming down, it's your outer meniscus that is injured. If you're turning out the other way and you're coming down, then it's your inner meniscus that is injured. And you'll know because you're going to feel pain in those areas. So wherever you feel that pain, most likely is where that meniscus is damaged. All right, so let me share my screen here with you guys for a second. And I'm going to show you that McMurray's maneuver. All right, because that's important to see. So let me blow this up. All right, so you should be able to see my screen. So I'm just going to mute this so we don't have to listen to them, and I'll explain it. So this is the test, right? So one hand supported here on the knee joint, the other hand here on the ankle joint, and all you're doing is kind of you're turning that tibia bone outwards, right? So this one's going out to the side, so you're biasing more of that inner meniscus right here, and then he's going to bring that leg down into full straightening. Okay, so if you have pain with that and discomfort, he's just doing it again a couple times, then most likely it's a positive test. Okay, if you go the other way, where if he turns you the opposite direction, instead of turning outwards, you turn inwards, it's going to show damage to the outer meniscus. And I'm going to show you guys the difference between those two right now. This is an awesome app. I use it with all my clients. I get no kickback from this. If you guys want to learn, get this app. It's very, it's affordable too. You pay monthly. It's called Muscle in Motion. This is really cool because you can see what's going on here. This is the femur bone. This is the tibia and the fibula. You can see this is the lateral meniscus I'm telling you about. So if they turn that foot all the way kind of inwards, right, towards the inner side of the body, it's going to bias more of the lateral meniscus here on the outer part of the V, excuse me. If they're going to turn it all the way the other way, you're going to bias more of the medial meniscus here. And these are just two C-shaped kind of curves here that sit between the joints. So I'm going to blow this up. I'm going to play this for you. And this just shows you exactly what we're talking about. This is the meniscus, right? This is the patella, your femur bone, your tibia, and this here is your medial meniscus. This is your lateral meniscus, right? Medial meaning innermost part of the body, or middle, right? Lateral meaning outermost part of the body. So you can see they're just like two little pillows there that sit between the joints. If you have a tear in that, anytime you bend or you kind of straighten your leg, typically it can be painful, especially if it's like a full or a complete tear. All right, so this is really just cool because it's showing you the anatomy, kind of giving you a 360 view here. Again, nice little pillow there between the femur and tibia. It's going to help absorb that shock force when you land or anytime you're running, right? Anyone like marathon runners tend to develop a lot of arthritis in their knees because that meniscus tends to wear down where it's almost like gone like this, right? So sometimes if they're overrunning and doing that repetitive activity, that meniscus eventually kind of disappears, and then you have bones rubbing against bones, which is technically inflammation, right? And then you're going to need surgery where they do a debridement, where they clean up the meniscus because it gets frayed like the end of an old towel or blanket. Or, you're going to have a knee replacement if it's that bad, and they're going to actually replace the whole knee joint, and then shave down some bones too. And guys, I've been in the OR for knee replacements. Like, don't get a knee replacement unless you absolutely need it. The outcomes are very good, but you're going to kind of have to deal with a lot of pain, and the recovery is not easy by any means. It's like working on a car. It's kind of crazy what they do in terms of shaving the bones down and everything. So try physical therapy, try medications first, try, you can get platelet injections, you can get gel injections, which serve the purpose of a meniscus too. Ask your doctor about them or ask your physician's assistant before you kind of decide to go under the knife. Okay. So that is pretty much everything for tonight. Let me stop sharing here. The last thing I want to leave you guys with is if you know anyone who can benefit from this or might have a meniscus issue going on, like if they have one of those positive tests we just talked about, they might have tight hips, tight ankles, or they're unable to tolerate load doing like a single leg squat or a normal double leg squat, or they have audible clicking or catching, joint line tenderness, right? Pain with legs straightening, if we do that bounce test, pain with someone bending their knee as much as they can, or that pain or audible click with that maneuver test, then I know it's a mouthful, but then they most likely are dealing with a meniscal tear or some type of damage to their meniscus. Okay. So this is the knee month, right? This is February, based around the meniscus. Thank you so much for watching. Really appreciate you guys. If you found this valuable, hit the like button. Don't forget to subscribe to our YouTube channel. We're going to have 3 other videos coming out this month based on the meniscus and how to treat it properly. And if you know one other person, feel free to share this with them who's dealing with knee pain. This might change their world by just watching this video so they have a better idea of what's going on and they learn a little bit about it. All right, I will see you guys in the next video. Have an amazing rest of your day. Take care.